Blood is the river of life, flowing tirelessly through our bodies every second of every day, keeping us alive and well. It delivers oxygen and nutrients to every cell, fueling our organs and tissues so they can function properly. But sometimes, this river gets blocked by a blood clot, a gel-like clump of platelets and protein strands that form suddenly and can disrupt the flow. Normally, clotting is a life-saving response, sealing wounds and preventing blood loss when we're injured. It's our body's natural defense against bleeding out. Without this process, even a small cut or scrape could become dangerous, leading to excessive bleeding and serious complications. However, clots can also form inside blood vessels without any visible injury, and that's when they become a hidden threat to our health. Medical conditions or long periods of inactivity, like after surgery, during illness, or even while sitting on long flights, can trigger these internal clots to develop. These clots don't help us. Instead, they block blood flow, creating dangerous obstructions that can cut off oxygen to vital organs. A clot in a leg vein can cause pain, swelling, and redness, making it difficult to walk or move comfortably. But if a clot forms in the heart or brain, the consequences can be severe, leading to heart attacks, strokes, or even sudden death if not treated quickly. The key is understanding the difference between helpful clots that heal us and harmful clots that threaten our health and well-being. Doctors and scientists are constantly working to find safer, more effective ways to treat these dangerous blockages, using advanced technology and new medicines. Recognizing the risks, understanding the warning signs, and knowing how to respond is the first step in protecting ourselves and our loved ones. Our body's ability to clot is truly remarkable. But when this process goes wrong, it can quickly become life-threatening and require urgent care. That's why medical science is so focused on distinguishing between helpful and harmful clots, and on treating them as effectively as possible. The story of blood clots is one of balance, between healing and harm, between protection and danger. Understanding this delicate balance is crucial for both patients and doctors, as it can mean the difference between life and death. Let's explore how medicine is rising to meet this challenge, and what we can all do to stay safe and healthy. When a clot forms in a deep vein, usually in the leg, it's called deep vein thrombosis, or DVT. This condition often develops silently, with many people unaware that a dangerous blockage is forming inside their body. DVT is more common than most realize, affecting hundreds of thousands of people each year. DVT can cause swelling and pain, but the real danger is if a piece breaks off and travels to the lungs, a pulmonary embolism, or PE. This is a medical emergency that can happen suddenly, sometimes without any warning signs at all. A PE blocks blood flow in the lungs, starving the body of oxygen and creating a life-threatening emergency. Without immediate intervention, the consequences can be devastating. Symptoms can appear suddenly: chest pain, shortness of breath, rapid heartbeat, even coughing up blood. These signs can be frightening and are often mistaken for other conditions, making quick diagnosis crucial. A large PE can be fatal within minutes. The window for saving a life is incredibly short, and every second matters. Clots can also block arteries to the brain, causing strokes, which may result in paralysis, loss of speech, or other severe disabilities. Or to the heart, causing heart attacks. These blockages can damage heart muscle permanently, changing a person's life in an instant. These events can lead to permanent disability or death. The impact extends beyond the patient, affecting families and communities. That's why doctors take internal clots so seriously. They can strike without warning. Even people with no previous health issues can be at risk. The location of the clot determines the risk, but the threat is always the same: blocked blood flow to vital organs. No matter where a clot forms, it can have catastrophic consequences. Fast, effective treatment is critical to prevent irreversible damage. Medical teams must act quickly and decisively. Blood clots are not just blockages, they're potential catastrophes. They can change lives in a matter of moments. Recognizing symptoms and acting quickly can save lives. Public awareness and education are key to early intervention. The medical community is in a constant race against time to restore blood flow. Every action, every decision, can make the difference between life and death. Every minute counts when dealing with these silent threats. The urgency cannot be overstated. That's why innovation in clot treatment is so important. New tools and techniques are giving hope to patients who once had few options. Let's look at how these clots have traditionally been treated, and how modern medicine is changing the fight against these hidden dangers. For decades, doctors have relied on anticoagulants, commonly known as blood thinners, to manage dangerous clots that can threaten lives. These medications have been a mainstay in hospitals and clinics around the world, forming the backbone of clot treatment for generations. These drugs don't actually dissolve clots but instead work by preventing them from growing larger, which gives the body valuable time to break them down naturally. This approach helps reduce the risk of complications like stroke or heart attack. Medications like heparin and warfarin have saved countless lives over the years, but they come with a major risk: bleeding. Even a small injury can become dangerous, and patients must be vigilant about side effects. Patients need constant monitoring, with regular blood tests and checkups, to balance clot prevention with the ever-present danger of spontaneous bleeding. This careful management can be stressful and time-consuming for both patients and healthcare teams. For life-threatening clots, doctors may turn to powerful clot-busting drugs called thrombolytics. These medications can dissolve clots quickly, but they carry an even higher risk of severe bleeding and can't be used in many patients, especially those with certain medical conditions. Sometimes, surgery is the only option, physically removing the clot through invasive procedures. While often effective, these surgeries carry their own risks, including infection and damage to blood vessels. Older methods, like balloon catheters, could break up clots but sometimes cause new problems, such as damaging the vessel wall or even creating new clots elsewhere in the body. These approaches, while groundbreaking in their time, highlighted the urgent need for safer, more precise solutions that could target clots without putting patients at additional risk. The challenge has always been to remove the clot without causing more harm, a delicate balance that has driven decades of medical innovation and research. That's where new technology comes in, offering hope for safer, more effective treatments that minimize risks and improve outcomes. The goal is clear: a safer, more targeted way to eliminate dangerous clots, protecting patients while restoring healthy blood flow. Enter the next generation of clot removal devices, designed to revolutionize how we treat this life-threatening condition. Medical engineers have developed a revolutionary device to physically remove clots without the bleeding risks of drugs or the trauma of surgery. This catheter-based technology uses a thin, flexible tube with a self-expanding mesh basket at its tip. Once at the clot, the basket deploys, capturing the blockage like a high-tech net. The procedure is minimally invasive, requiring only a tiny incision. Doctors use imaging to guide the device directly to the clot, ensuring precision. Different versions are tailored for various blood vessels, from large leg veins to delicate brain arteries. This approach, mechanical thrombectomy, removes the clot in one clean procedure. It's a major leap forward in safety and effectiveness. Let's see how this device works in action. The procedure starts in a specialized operating room, with the patient lightly sedated but usually awake. A small puncture is made, often in the groin, to access the blood vessel. A guide wire is threaded through the vessel, using real-time X-ray imaging for navigation. The catheter carrying the collapsed device follows the guide wire to the clot. At the blockage, the doctor deploys the mesh basket, which expands to fit the vessel and seals off the clot. The basket acts as a filter, preventing pieces from breaking loose. The doctor then carefully pulls back the catheter, capturing the clot inside the basket. The entire assembly, catheter, basket, and clot, is removed through the original puncture. Blood flow is restored immediately, and the doctor can confirm the clot's removal. The procedure is quick, precise, and minimally invasive. Patients often experience rapid relief of symptoms. Recovery is faster and less painful than traditional surgery. This is how modern medicine tackles dangerous clots head-on. The new device offers unmatched precision, targeting only the clot and sparing the rest of the body. Unlike clot-busting drugs, it doesn't increase the risk of dangerous bleeding elsewhere. This makes it a safe option for patients who can't tolerate traditional treatments. The procedure is fast, removing the clot in a single session, often with immediate symptom relief. Quick restoration of blood flow is critical, especially in strokes or pulmonary embolisms. The minimally invasive approach means less pain, lower infection risk, and shorter hospital stays. Many patients can walk within hours and go home sooner. The technology reduces healthcare costs by speeding up recovery and freeing up hospital resources. It's a game changer for both patients and doctors. More people can be treated safely and effectively. The benefits are clear: safety, speed, and better outcomes. Let's see how this plays out in real life. Consider John, who developed a DVT after knee surgery a decade ago. He faced days in the hospital on blood thinners, constant monitoring, and a slow, uncertain recovery. The risk of bleeding and long-term complications loomed large. Now meet Sarah, who recently had the same surgery and developed a similar clot. Thanks to the new device, her clot was removed in under an hour through a tiny incision. She felt immediate relief, faced minimal bleeding risk, and was home the next day. Her recovery was faster, with less anxiety and fewer complications. The difference is dramatic, from days of worry to rapid, safe resolution. This technology transforms the patient experience. It's not just about saving lives, it's about improving quality of life. That's the power of innovation in medicine. This device doesn't just help patients, it benefits the entire healthcare system. Faster procedures and shorter hospital stays free up beds and resources. The upfront cost is offset by lower overall expenses and fewer long-term complications. Patients return to normal life sooner, reducing the economic burden of illness. Doctors gain a powerful new tool, allowing for more personalized, effective care. Collaboration among specialists leads to better outcomes. The psychological relief for patients is immense. Knowing the clot is gone brings peace of mind. This technology represents a shift toward value-based, patient-centered care. It's a win for hospitals, doctors, and most importantly, patients. The ripple effects are transforming modern medicine. The future of blood clot treatment is brighter than ever. Mechanical thrombectomy devices are just the beginning. Expect even more advanced, precise tools ahead. Innovations like built-in sensors and AI guidance are on the horizon. This technology could soon become the standard for treating dangerous clots. The result: fewer deaths, less disability, and faster recoveries. The principles behind these devices are inspiring new treatments for other conditions too. Each breakthrough builds momentum for more progress. Ultimately, this is about peace of mind, turning emergencies into manageable events. Doctors gain confidence and patients gain hope. The river of life can keep flowing, safely and surely.